planning for ongoing care for someone with dementia. Dementia is a progressive condition. This means that over time, symptoms will increase, and the person affected will need more assistance in carrying out their daily activities. As the condition progresses, caregiving can become more challenging and time-consuming. It is important for caregivers to remember that you don't have to do it all. Here are some care options that you might find helpful depending on the needs of the person you are caring for. Adult daycare involves on-site health and social services provided in a community-based setting for 4 or more hours per day, 1 or more days per week. Some adult daycare centers also provide transportation to and from the center. Adult day services are best suited for persons in early-stage dementia who need some supervision but are mostly independent with personal care, such as bathing, using the toilet, dressing, eating. Most people in early-stage dementia can benefit from the recreational activities and social interaction they will get at adult daycare. At the same time, caregivers can get a break while the person is at the daycare center. Medicare does not cover adult daycare services. However, Medicaid and other state government programs may cover the costs of these services. To locate adult day centers in your area, you may contact your local Alzheimer's Association chapter or the Department on Aging in your state, or visit the Elder Care Locator website. Homemaker services include services provided at the person's home by a worker who comes over to assist with household chores such as grocery shopping, preparing meals, and housekeeping tasks like washing dishes, doing laundry, and cleaning floors. The number of homemaker hours per week might vary depending on the person's needs. Homemaker services might be beneficial to someone in early or middle stages of dementia who needs help with household chores, errands, and companionship. Homemaker services are not suitable for persons with significant medical needs or persons who need help with personal care tasks such as bathing, dressing, and feeding. Medicare does not cover homemaker services. However, Medicaid and other state government programs may cover the costs of these services. To locate homemaker services in your area, you may contact your local Alzheimer's Association chapter or the Department on Aging in your state, or visit the Elder Care Locator website. A home health aide is a worker who comes home to assist someone with personal tasks such as bathing, dressing, and grooming, and to check vital signs such as heart rate, temperature, and blood pressure. This medical monitoring is done under supervision of a nurse. The number of home health aide hours per week might vary depending on the person's needs. Since home health aides are able to provide more complex care, their services might be beneficial to someone in middle to late stages of dementia who needs hands-on personal care or requires basic medical monitoring. Home health care includes visits from a trained healthcare professional such as a nurse, occupational therapist, physical therapist, or speech-language pathologist. The frequency of visits can vary depending on the patient's needs. Home health care services might be beneficial to someone in mid to late stages of dementia. These services are meant for persons who are homebound and need skilled care and assistance with managing medications, setting up or monitoring medical equipment, wound care, and recovery from a fall or surgery. Home health services may be covered by Medicare, Medicaid, and Veterans Affairs, but you will need certification from a physician stating that the person has difficulty leaving their home and needs skilled care. To locate home health services in your area, you may use the Medicare online tool. When caring for the person at home is not possible, residential care might be an option. An assisted living facility is a residential care option that provides a safe living environment, including housing, meals, and support with personal care such as bathing, dressing, and housekeeping. Specialized memory programs may also be available in some facilities. Assisted living expenses are not covered by Medicare or Medicaid. A nursing home is a residential setting that includes support with personal care plus 24/7 medical care. Therapy services such as occupational, physical, and speech therapy may also be available. Medicare only covers short-term stays in a nursing home. Long-term stays might be covered by Medicaid and Veterans Affairs. Assisted living might be better suited for someone with early to mid-stage dementia who needs some assistance with daily activities and has mild to moderate memory loss, confusion, and behavior changes. A nursing home might be better suited for someone with mid to late stage dementia who has complex medical needs such as feeding tubes or wound care. A nursing home is also appropriate for someone who needs total assistance with personal care and has more advanced symptoms such as severe confusion, risk of falls, wandering, and aggressive behavior. Hospice care is specialized care for persons with life-limiting illness. This includes comfort care, which focuses on managing symptoms and preserving the individual's quality of life. Hospice care may be provided at home, at a hospice center, an assisted living facility, or a nursing home. Families often don't know when is the right time to get hospice care for their loved one. This option might be considered for someone with end-stage dementia who is unable to move about by themselves, is unable to control bowel and bladder function, has difficulty swallowing, frequent infections, and frequent hospitalizations to an extent that is significantly reducing their quality of life. Hospice care costs may be covered by Medicare, Medicaid, and Veterans Affairs, but you will need certification from a physician stating that the person has a life-limiting condition. Employer-provided health insurance may also cover some costs related to hospice care. Hospice providers also accept private payment, referred to as self-pay, which may be an option for patients without health care insurance. Discuss all options with your doctor before deciding what care option is the best for your situation.